At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Constipation When the Going Gets Tough on Wednesday, August 20th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey everybody, welcome to Dr. Tom Roselle Live. This is yours truly, Dr. Tom, and we got another great program for you today. You're listening to me on WMAL 105.9 in the Washington metropolitan area. And make sure you tell your friends about us so we can give them ongoing health information so you can be better and they can be better and the whole world's a better place. And we take the burden off of, everybody when it comes to healthcare costs, because the truth of it is that your health is in your hands, and it's a do-it-yourself program, my friends. When you go down the tubes, you did it. When you end up getting better, you had a whole big piece of that puzzle. Everything else is just crutches to kind of help you get that way. But let's talk a little bit about you this morning. I've been paying attention the last few weeks. We've kind of been focusing a little bit on the intestinal tract, and because it's so important relative to your immune system and other things that show up that you don't know where it's coming from. And we're going to do a little bit of that today as well, but in a different way. I want to talk about chronic pain patterns as it relates to your body's capacity to resolve them. And what I mean is this, when that pain never goes away and you're always dependent on something else, where is it coming from? And often, more often than not, it can come from the intestinal tract. And you say to me, what? Why? Why is it my gut that's the issue? Well, because it's well known that your intestinal system is about 70 up to 80% of your immune system, depending on the author that you read. But either way, low end or high end, it's quite a bit, right? So if that's the case, what happens when we have chronic pain patterns, chronic immunological triggers of pain? And so chronic pain can trigger a range of responses and suppress immune system, or the immune system not working the way it's supposed to can cause chronic pain. You say, okay, that's double talk. What's going on here? And so let's break it down just a little bit. Let's say, okay, we got chronic pain. It's all over the place. Somebody gave it a sign. By the way, your diagnoses that your doctor gave you, whether it's inflammatory rheumatoid arthritis, juvenile rheumatoid arthritis, it's chronic pain syndrome, it's fibromyalgia, you have chronic migraines, you have whatever it is. Those are nothing more than terms that tell you where the pain is, but not where it's coming from. So arthritis, arthro, joint, itis, inflammation, chronic inflammatory reactions in the joints, it can be made much worse because of chronic pain from other things, or it can be initiated by itself and then causing chronic pain patterns and so forth. So we all know that, for example, rheumatoid arthritis is an autoimmune condition, supposedly, that starts in the intestinal tract. So if you look up the definition, it says it's an immune-modulated chronic inflammatory reaction of the joint spaces. Okay, so how do we fix it? How do we manage it? How do we, get it to turn around? Can the body begin to heal 100%? Well, the truth of it is, yes, it can be. So then you have these conditions called polymyalgia rheumatica. And that means that there's a mimic of other types of inflammatory reactions that they really don't know where it's coming. Poly just means many joints, many muscles. Polymyalgia. Poly means joints. Rheumatica, rheumatic something, rheumatism. That's where that word came from a long time ago. But the question still has to be answered: where does it come from, and is the immune system responsible for that? There was an article that I read in an interesting journal, it's Neuroscience Specialist Journal. And, every once in a while I wander through this stuff. Sometimes I don't think I have the brain mass to really understand it all, but I try. And it says, you should understand that the basic idea of pain, right? The basic idea of pain is nothing more than an interpretation of other things that are going on in the body by certain cells in the nervous system that are called nociceptors or nociceptors. And they transfer information of different types of stimulation, like heat and other chemicals, to the spinal cord. And the spinal cord then mediates it out to these other signaling elements. So what's that got to do with your gut? Well, if your gut is not working the way it's supposed to, then it triggers these cells, these nociceptors, to transfer the information to your spinal cord. So bad gut, bad inflammation, bad irritable bowel disease, constipation, diarrhea, all those things can cause that transfer to the cord, to the spinal cord, that causes this information to be processed. And by the way, if you want to look it up, it's called nociceptive signaling. And the information is now basically becomes an electrical signaling. And it can be turned up and it can be turned down. And it can also be controlled if the signaling is sent to the brain. So when you have a chronic pain that develops after a injury to the nervous system, and we're going to go the other way, okay? So the pain now is there because you actually got hurt. Something took place that was localized, right? The chronic pain that develops after an injury, we call it in my profession a spinal distortion subluxation pattern. Cranial injury, the 22 bones of your brain get locked up. There's a concussive pattern of localized inflammation. The signal reaches the brain, and guess what? What do you have? You got pain. So chronic pain continues to stress and affect the immune system because of that ongoing wind-up situation. Now, here's the deal, and this is what we're going to talk about when we go to the live stream today. I want you to follow me. Go to drtomroselle.com and follow me on that. We're going to talk about your immunological reactions. Now, your immune system, and I'll talk just as a lead in just a little bit, is 70 to 80% your intestinal tract. If that's the case, if you've got all of that stuff going on in your gut and you got a bad gut, then these good guys that are supposed to help inflammatory reactions aren't going to work. You heard a bunch of that stuff during COVID, right? Interleukin 6, which is really the bad guy, interleukin 1, but interleukin 10, interleukin 17, interleukin 22 are the guys that help you and modify it. But if your gut's a mess and it's not working the way it's supposed to, the good bacteria is not there, then you got a problem. Then you can't get rid of stuff. You can't protect yourself. You can't beat it up. We get in the live stream, we're going to talk about how invaders, the bacteria and the viruses and the funguses and the other bad guys come in. And if they're not stopped, if they're not broken down by your innate immune system, your natural immunological support, then you have this ongoing reaction. We just talked about what happens, right? So something bad happens in a system, it goes to where? It goes to the spinal cord. From the spinal cord, it goes to the brain. The brain interprets it as what? Pain. And so now you've got this constant recidivistic wind-up pattern that is about that. So the whole idea is, can it be shut down? The short answer is yes. Chronic pain and continual stress, all kinds of stress. Remember, in my world, we talk about stress being what? Injury, biochemical, bioelectrical insults from the outside, and stress based on how your mind is interpreting something. If you focus on one thing, you're always interpreting it that way, then your body is going to perceive stress ongoing constantly. In fact, what happens over a period of time, it begins to reprogram your functioning in your genome, your genes, and that expresses your immune system. By the way, mRNA vaccine did that to all of you. Now they're finally, admitting that that's what took place. And it really shut your immune system. It didn't help anybody. It didn't modulate anything. It was set up as a biological weapon back in 1954 when they first started doing the research on it. So when you understand that, then you understand that any external environmental noxious situation, maybe not as quickly, but slowly, can begin to break down your own body's response. And these key fighters of infection closely monitor changes and react to pain. So it's kind of crazy, right? But it made things much, much worse. Many of you, because of the vaccines that you've taken, COVID and others, by the way, are constantly suffering from all kinds of weird type of things and diseases and processes. So if you have pain, you could end up with other problems within your body, cardiovascular problems. If you have intestinal tract problems, you could end up with chronic pain, which ends up giving you more predisposition to cardiovascular disease and strokes and diabetes and other conditions. So it's all going back, finger pointing to that gut of yours. And we don't take good care of it. We allow it to go down the tubes quickly. Can we fix it? Yes, we can fix it. You have to know the steps that you need to take, and we'll be doing that with you and for you on the 20th of this month. And please join us. I promise you're going to go away with a ton of data. Remember, our in-house programs are always our gift to you. They're no charge. The only thing that we ask you for is a reservation. And you do that by going to rosellecare.com, 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 or do it the old-fashioned way. Call us 703-698-7117, 703-698-7117, and make that appointment and join us. And we will give you a ton of data. Dr. Qinglong Zhang, who is a master in traditional Chinese medicine. He was very well known in Shanghai before he came to the States, and he has dual degrees. Great physician. Many of you know him. We're going to talk about that. We're going to go back and forth. I'm going to be talking about the infections process. He's going to tell you how things can be resolved. We'll both step into that. We're going to answer your questions, and I'll ask you things, and I'll say, yeah, you don't have to answer me. How many of you have normal bowel movements, meaning that every day you go at least once, twice, maybe 3 times a day, every time you have a meal, and they're normally 4 and everything's cool? That's perfect, by the way. And if you're not, then how long do you go? And again, I say, no, you don't have to answer me. Just think about it a little bit. And think about all the toxin that is being absorbed. And if you're having to use stimulants to get going all the time, it tells you that you're missing the target. There's something else that is not doing what it's supposed to be doing. It could be your back. It could be where the nerves that go to the intestinal tract are not firing. It could be your upper neurological system, your brain and your upper spinal cord, because that's where the vagus nerve, your 10th cranial nerve, comes from, and it affects the intestinal system all the way through. I've had patients who've had car accidents, and I see them years later, sometimes months later, sometimes immediately. And they say, since I've had that accident, my bowels have never worked right again. I say, oh, really? Tell me more about that. And so we start getting into the formation of things, and we start talking about, what it looks like, and, cramping and pain and discomfort and so forth. And then I ask about other pain patterns. I ask about, do you end up having, these generalized kind of sick headaches that just don't seem to go away? Do you end up with pressure in your face, almost like a sinus headache? Because, by the way, your sinuses and organ muscle patterns relate to the intestinal system. So if you got a bad gut, you're going to have sinus problems. And you need to know how to resolve that. Hormones are going to be off. Neurological and endocrine system is affected by a bad gut. If your gut is bad, you remember it reflexes to the cord. And then that spill over, meaning the organ muscle relationship, can affect multiple systems. And then we end up what you take immunosuppressive agents because your doc says, well, you got colitis, you got this, you got that, and they put you on steroids or they put you on other things, and it inhibits, suppresses your body's natural immunological system. So wouldn't you like to get off the merry-go-round? Wouldn't you like to really find out what you can do to make a difference? Well, you can. We're going to do that on the 20th. Please join us and really find out what you can do to make a difference. There's this condition called polymyalgia rheumatica. We talked about that when we first started the program. And it's way too often diagnosed. And it's not necessarily that. People are hurting. It's not except that. Here's the deal. Too many, in my opinion, there's too many guys out there, too many practitioners that like to just dump a diagnosis on you because they really don't know, but it's a kind of a catch-all thing. Fibromyalgia is another one. You've heard me talk about that before. So they talk about this polymyalgia rheumatica is an inflammatory rheumatic disease. It's a disease that causes your body's immune system to attack your joints, your muscles, your bones, your organs, and so forth. Well, is that really what it is? The next question is, where is it coming from? Well, they can't tell you the why because they don't know. If they knew the why, then you could fix it. See, in my world, what I look at is your body's ability to do what it's supposed to be do because it was created that way, that your creator, God, gave you the ability to repair and fix and turn things around. But you have to look at it for what it really is. It's not something decided to attack you. And then some physicians will tell you, well, it's epigenetic. Okay, that's great. So epigenetic means that the outside environment, your environmental stress, your environmental food, your environmental exercise or lack thereof, has a profound effect on your gene expression. And if it does, if it has an effect on your gene expression, well, then you can begin to shift things. But here's the other piece, the one that they don't tell you, that you only use about 46 different pairs of chromosomes. And you got a whole lot of others sitting in the background. And so you can express those differently and rearrange them and put new ones in place, if you will, using that type of vernacular, and make yourself better again. Why do you think some people who live really well and they walk and they eat the right things and they do good ongoing stress modification stuff, they pray, they meditate, they do things like that, and they always have a persona that is something you'd like to be around? You're almost afraid to be around it because how the hell can they be so happy? But they feel better across the board. They have more energy. They look younger. They have an outlook that most of us would, wonder, where did they get that from? But I'm here to tell you that you can change this. Things like polymyalgia rheumatica can be modulated, can be turned around. It can be made different. So it's not dependent on drugs and taking steroids and, following that. Let's do what your body is supposed to do. Let's begin to shift and change and protect and build up, right? So DNA changes. DNA can change because of chronic ongoing pain, and it affects their ability to fight infections. We talked about that to begin with. Because we're getting ready to go into the live stream, I want to kind of put this in your head. If your immune system is 70% located in your intestinal system, and you know you don't eat well, and you know that you should be having certain balances, and you have an irritable gut, and you have constipation, you have diarrhea, you have a lot of cramping when you eat certain things, you're so bloated, you look like a balloon, and you can't figure out what that's all about. It's affecting your immunological responses. You're going to see things like constipation. You're going to hurt. You're going to see things like diarrhea ongoing. It doesn't stop. You're going to start shoving medications in there, which unfortunately produce the same symptoms that you're trying to modify. But what is it that you usually complain about? You start complaining about pain. Headache pain, shoulder pain, joint pain, multiple system dysfunctions, because that gut's not working the way it's supposed to work. So we're going to walk through that mess, if you will. We're going to try to fix it and give you the strategies that you can use to resolve it, to fix it. Not just putting a Band-Aid on it, but how about getting your life back? How about resolving the issue once and for all? I don't know about you, but I like to live that way. I like to make sure that my body is doing what it was designed to do. I don't want to use topical steroids, to reduce inflammation in the local setting, because it starts breaking down everything. It's absorbed in your system. You start taking systemic steroids, or other types of inhibitors, pain blockers, NSAIDs. They actually destroy the joints. If you start taking immune suppressants, for chronic and resistant types of situations, and they're using that for the gut. They're coming out with all kinds of finger pointing now with this GLP-1 medication, which is a biological. So it's shutting down all kinds of processes. And by the way, they just showed a couple articles the other day that when you're taking a GLP-1 and it supposedly modifies, your body's hunger pattern and starts burning fat up and so forth, guess what? Joint spaces are starting to show up symptomatically. Teeth are becoming loose in people's head and the tissue is being withdrawn. That would get my attention. I don't know about yours, but it would tell me, there's got to be a better way. And there are better ways across the board. There's better ways for everything. And we're going to show you how to make this system work better for you, to support your immune system so you can absorb things properly. Something just very, very modifiable. If your gut's not working, you're starting to produce toxic chemistries that can lead to cancers, that can lead to degeneration, that can lead to other problems that they chase their tail with, and then more steroids and more inhibitors and things of that nature. Once you'd like to find out if there's another way, we're going to show you what to do. We're going to show you how to make it happen. We're going to show you that different conditions like fungus and lichen planus and that all that erosion that shows up in different parts of your body, particularly your tongue and so forth, can be resolved and modified dramatically if you know what you're really dealing with. And that's the whole topic of the 20th. So Wednesday evening, 6 p.m. at the Roselle Center for Healing in Fairfax. Make sure you make your reservations today, right now, as soon as I'm done on the program. And follow me, by the way. We're going to the live stream right now. We're going to continue the process and the conversation. I'm going to give you some more details on this. Remember, I'm here every Sunday, giving you a little bit better piece of the information for one reason only. I love you all. Have a great day. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Constipation When the Going Gets Tough on Wednesday, August 20th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.